So question here, the client is scheduled to have an intravenous cholangiogram. Before the procedure, the nurse should assessment the patient for what? A, any kind of allergies to the shellfish, react to the blood transfusion, C, gallbladder disease, or D, egg allergies. The correct answer is E, right? We have to check any kind of allergy to the shellfish. So the client having the dye procedure should be assessed for allergies to iodine or shellfish. So answer B and D are incorrect because there is no need for the client to be assessed for reaction to the blood or eggs. Because an IV cholangiogram is done to detect the gallbladder disease, and there is no need to ask about the gallbladder disease or not. So answer C is not correct. And next here, shortly after the client was admitted to the postpartum unit, the nurse noted heavily lochia rubra and large clot. So patient in postpartum unit, and we observe have lochia, heavy lochia rubra with a blood clot. So it is shortly after, important, the nurse should anticipate the order for A, methargine, B, stedol, C, magnesium sulfate, and D, phenergan. So correct answer is number A, methargine. So methargine is a drug that causes the uterine contraction. It is used for postpartum bleeding or hemorrhage, and that is not controlled by the ketone. So answer B, C, and D are incorrect. And stedol is an analgesia, not for the hemorrhage. Mag-sulf or magnesium sulfate we use for preeclampsia or eclampsia, not for hemorrhage. And phenergan is an anti-emetics. Next, the client with a recent liver transplant asks the nurse how long he will have to take immunosuppressant, right? Immunosuppressant is the medication we give after kidney transplant, liver transplant, right? Which response should be correct? Immunosuppressant, A for 1 year, B for 5 years, and C for 10 years, and D the rest of his life. The correct answer, immunosuppressant have to take rest of his life, right? Medication named cyclosporine is a immunosuppressant, and the client with a liver transplant will be on immunosuppressant for rest of his or her life. Answer A, B, C, then are incorrect. The client is admitted from emergency room with a multiple injuries and sustained from an auto accident. His doctor prescribed a histamine blockers. The nurse is aware that the, the reason for this order is for treat general discomfort, B, correct electrolyte imbalance, C, prevent trace ulcer, and D, treat the nausea. So when we read this question, it is important to find out the keyword. Let me read one more time what they wrote. Client admitted from emergency room with a multiple injuries because of car accident. His doctor prescribed histamine blockers. The nurse is aware that reason for this order why. The correct answer is number C, to prevent the trace ulcer. So histamine blockers are frequently ordered for the client who are hospitalized for prolonged period and who are in a stressful situation or condition. So question, the nurse is aware that the reason for histamine order, why? To prevent the trace ulcer. Because our client who are hospitalized for a prolonged period, who are in a stressful condition, they have a chance to develop ulcer, so this medication can stop it. So they are not used to treat discomfort or correct the electrolyte or treat the nausea. So histamine are not used for electrolyte imbalance, are not used for treatment nausea, not for generalized discomfort. So it is not answered. Next, the physician prescribed regular insulin, like 5-unit subcutaneous, and regular insulin begins to exert as an effect. So physician prescribed regular insulin, right? 5-unit subcutaneously, and regular insulin began how much dose effect? So A, 5 to 10 unit, B, 10 to 20 unit, C, 30 to 60 unit, and D, 60 to 120 units. So the correct answer is C, 30 to 60 minute, not unit, minute. So the time of onset for regular insulin is, time of onset of regular insulin is 30 to 60, means half an hour, 1 hour. The answer A or B and D are incorrect because they are not the correct answer. This question also about the insulin. A new diabetic is learning to administer his insulin. He received 10 units of NPH and 12 units of regular insulin each morning. So NPH and regular insulin. Which of the following statement reflect, understand the nursing teaching? It say A, when draw up my insulin, I should draw up regular insulin first. B said, When draw up my insulin, I should draw up NPH insulin first. And number C said, it does not matter which insulin I draw up first. And number D, I cannot mix insulin, so I will need two different shots, right? So here is very important. Every student must know when we need to draw up the insulin, always regular insulin should draw first. NPH, basically it is called normal, um, I mean, this is the insulin, not regulin. So we use, so NPH insulin is an isofen suspension of human insulin, and they are categorized as an intermediate acting insulin, right? So correct answer is here, A, means regular insulin first. So regular insulin should be drawn up before NPH, and they can be given together. So there is no need for two injection, like two shot. So D is not answer. B and is not correct or incorrect. Answer C is incorrect because it certainly those methods which is draw first, and contamination of NPH into the regular insulin will result in a hypoglycemic reaction at unexpected times. What else? Question here, a 60 years old diabetic patient taking oral medication, glyburide. What are the dose? 1.25
milligram daily to treat
so
type 2
milligram
diabetes.
and to treat the type 2 diabetes mellitus. Which statement indicate the need for further teaching, right? So keep it note, if your patient has a type 2 diabetes, always treated with oral hypoglycemic medication like metformin, glyburide. But if patient have a type 1 diabetes, most of the times treated by insulin. So out of 4, what is doing wrong, your patient need to correct. Which statement indicate need further education, means they doing something wrong about the medication, I need to correct them. He said, I will keep candy with me just in case my blood sugar go drop. Nothing bad. You do it for the safety. B said, I need to stay out of sun as much as possible. Yeah, nothing bad too. Because strong sun can cause dehydration. And number C, I often skip my dinner because I do not feel hungry. Oh my God, this is dangerous, right? Means I have to tell them, don't do this. So C is the answer. This I always wear my medical identification bracelet. So nothing wrong. So correct answer is the C. So the client should be tough or educate, reinforced to eat his food, his dinner or lunch, even if he is not hungry. Why? To prevent hypoglycemic reactions? Answer A, B, and D are incorrect because they indicate knowledge of the nurse that is teaching is good enough. So question here, a 20 years old female has a prescription for tetracycline. Tetracycline is an antibiotics, right? While teaching the client how to take her medicine, the nurse learned that the client is also taking another medication is called Ortho-Novum. That is oral contraceptive medication, which instructions should include the teaching plan. When antibiotics or oral contraceptive pills together, the oral contraceptive will decrease the effectiveness of tetracycline. B, nausea often result from taking oral contraceptives and antibiotics. C, toxicity can result when taking these two medications together. And these antibiotics can decrease the effectiveness of oral contraceptives. So the client should use an alternate method of birth control. So this is the answer, right? So what instruction should be included? This is the information need to include it. So taking antibiotics and oral contraceptive together decrease the effectiveness of oral contraceptives. Answer A, B, and C are not necessarily true. What else? Next questions. The client is taking prednisone 7.5 milligram orally. And this medication take every morning to treat his systemic lupus erythematosis, shortly called SLE, or when it is attack the kidney, we call lupus nephritis. Which statement best explain the reason for taking prednisone in the morning? Steroid we use for SLE, but why we need to take it at morning time? So A, there is a less chance for forgetting the medication if taken in the morning. And B said, there will be less fluid retention if taken in the morning. C, prednisone is absorbed best with breakfast food. And D, morning administration mimic the body's natural secretion of corticosteroid. This is the scientific explanation why I will tell my patient, please take the steroid or prednisone at the morning to treat the systemic lupus nephritis. So taking corticosteroid or steroid or prednisone in the morning, they mimic the body's natural release of steroid or cortisone. So answer A is not necessarily true. Answer B and answer C are not true. Next, the client is taking anti-tuberculosis medication called rifampin 600 milligram orally daily to treat his tuberculosis. Which action by the nurse indicate understanding the medication? A, telling the client that the medication will need to be taken with juice. B, telling the client that the medication will change the color of the urine. And C, telling the client to take the medication before going to bed at night. And D, telling the client to take the medication if night sweat occur. So correct answer is B, telling the client that medication will change the color of the urine. So your patient will know about this. So they will not be worried if it is changed the color. So rifampin, the medication called rifampin, can change the color of urine and even body fluid. So educating or teaching the client about this change is the best because he might think this is a complication, right? So answer A is not necessary. Answer C is not true. Answer D, not true. Because this medication should be taken regularly during the course of the treatment. What else? Next, yeah, the client is diagnosed with multiple myeloma. The doctor has ordered cyclosporine, immunosuppressant for multiple myeloma. Which instruction should given the client? Number A, walk about a mile a day to prevent calcium loss. B, increase the fiber in your diet. And C, report nausea to the doctor immediately. And D, drink at least 8 large glasses of water a day. So my patient has a multiple myeloma. Multiple myeloma, also known as myelomatosis or plasma cell myeloma. Multiple myeloma is a cancer of mature plasma cell in the bone marrow. And this causes the bone pain in the chest or spine. Also, patient complain fatigue, nausea, constipation, frequent infections, and weight loss. So the correct answer is D, drink at least 8 large glasses of water a day. And your patient take the medication cyclophosphamide. Cyclophosphamide can cause hemorrhage or can cause hemorrhagic cystitis. Cystitis means inflammation the urinary bladder and causes bleeding from urinary bladder. So the client should drink at least 8 glasses of water a day. Prevent the complication or cystitis. Answer A, B are not necessary and so are incorrect. Nausea often occur with chemotherapy. So answer C is not important, do not need to notify the doctor because it is expected. Next question, a elderly client is diagnosed with ovarian cancer and she has surgically followed by chemotherapy with fluorouracil that is given intravenously. What should nurse do if she notices crystals in IV medications? So A said, discard the solution and order a new bag. B, warm the solution. C, continue infusion and document the findings. D, discontinue the medication. So what is the answer? Right? So the correct answer is here, discard the solution and order a new bag. Right? So crystals in the solution are not normal and should not be administered to the client. Because what should the nurse do if noticed a crystal in IV medication? So crystal in the solution are not normal and should not administered to the client. Discard the bag solution immediately, right? So answer B is incorrect because warming the solution will not help. Answer C is incorrect and answer D require a doctor's order. Discontinue the medication is not, you can't do this.